On your side, investigators, local pharmacists caught putting your health at risk, making mistakes most people never know about.
The Oregon Board of Pharmacy has cited dozens of pharmacists for serious violations, from handing out wrong medications to enabling drug abusers and even worse. Our newest On Your Side investigator, Joe Douglas, discovered some of these pharmacists are still working. And Joe, the state website supposed to alert consumers about them was a mess until today.
Steve, Deb, we got them to make some big changes, and here is why that's important. I grew up going to the Kaiser Permanente Clinic in Beaverton, like a lot of kids in Washington County. This report from Oregon's Board of Pharmacy really hit home with me. It says a pharmacy tech there last year was fall down drunk at work. They say she had a blood alcohol content of 0.18 about 4 hours after starting her shift. Now, she no longer works there, but this is just one of several shocking violations we've found in our area. When Providence Hospital ER doctors treated pharmacist Van Tron last year, a report from the board says she had so many prescription drugs in her system, she was nearly comatose. The state had already put her on probation for stealing and taking drugs. Her license was revoked. In 2011, Beaverton police arrested pharmacist Deborah Pham on suspicion of DUI and possession of drugs they say she stole from a Walgreens. The board proposed to indefinitely suspend her license and put her on probation. Her license is now active. At the Fred Meyer on North Lombard Street in Portland, investigators say pharmacist Donald Lawrence stole amphetamines from capsules, resealed them, and placed them back in stock where they were available to be given to a patient. The board says Lawrence had a 20-year history of drug and alcohol abuse. His license was revoked. But many of the people cited in the records we dug up are still working, though one of them didn't want to admit it. You work, though, still as a pharmacist?
No. I'm retired.
That's what Matthew Maynard told me after I showed him a report outlining nearly 20 dispensing errors the state says he made at a Walgreens in Milwaukee. The board says he gave out the wrong medications, the wrong doses, and sometimes the wrong directions. Other employees at the store tell me Maynard still works there, part-time.
How often would you say you fill prescriptions here?
Probably 4 times, 5 in a month.
Customers were shocked to see our findings.
There's a lot of people that depend on some of those medicines and stuff. It's absolutely wrong.
The dosage, is so integral to being, safe. You could kill somebody. That's dangerous.
Portland lawyers Mark McDougal and Greg Kafoury say they've handled around 40 cases involving pharmacy errors over the last 2 decades. In some cases, they say patients were seriously hurt. At least 2 lost their lives.
They definitely filled it, and he definitely died.
6 years ago, they say investigators found all of these empty pill bottles in the apartment of a man who overdosed. They contained huge amounts of pain medications from prescriptions written at the now closed Payette Clinic in Vancouver.
We're talking about these pill mills turning people into zombies.
Pharmacies in Portland handed out many of the drugs.
There is no reason why this prescription should have been filled.
McDougal and Kafoury say they believe most pharmacists are honest and ethical, but that with others, you're taking a big risk.
They have, the pretense of providing medical care, but in fact, they all they're doing is handing out pills.
Should people feel safe about going to the pharmacy?
Oh, absolutely.
Fiona Karbowicz is with Oregon's Board of Pharmacy. She says pharmacists are most commonly cited for giving patients the wrong medications.
Though it is a possibility, it's actually quite rare that the board hears cases involving patient harm.
Karbowicz says pharmacies are inspected once a year. The board also investigates reports from patients and professionals working in the pharmaceutical industry. It looks into around 600 cases annually. From 2008 to 2012, the board submitted more than 600 adverse action state licensure reports to a national data bank.
Do you think that the public should be aware of this?
They should be aware of it. Because it's messing with people's lives.
The board said in the spirit of transparency, it has a tool that anyone can use to find reports on pharmacies and pharmacists. But we tried it and it was a mess. If you were looking up a big chain store, for example, like Rite Aid or Walgreens, it would say, this search will return more than 100 records. Please narrow your search criteria. You'd get the same result if you entered the names of many cities. Really, you had to know license numbers and exact names to get most any results, meaning a lot of people were being left in the dark.
You're completely at the mercy of a pharmacy. People assume that they're dealing with professionals who are skilled, who are knowledgeable, who are looking out for them. The point is that it's not always so.
Now, our investigators were able to plow through that difficult website to help bring you all this information. And after dealing with us, Oregon's Board of Pharmacy promised to make the site more user-friendly, and they delivered. I logged on today, and it is much easier to use. We've actually posted a link to it at k2.com.
You already helped create change.
Yes, it was a really gratifying feeling.
Yeah, good story. Very interesting stuff, Joe. If there's a story you think our investigators should dig into, we'd love to hear from you. Send an email to investigators@katu.com.